Alright, so this video is going to discuss anemia. There's a couple different kinds. This one's just going to be one kind. Just in general, anemia is either a decrease in red blood cells or a decrease in hemoglobin, which then leads to a decrease in the oxygen carrying capacity of the red blood cell. So basically, the red blood cell is kind of like a car, and it has this thing called a hemoglobin, which is kind of like the seat, and that's where oxygen sits. So if it doesn't have the hemoglobin, oxygen cannot travel. So the tissues become hypoxic if they don't receive oxygen. So that's just kind of in general. Some general signs and symptoms of anemia are being pallor, fatigue, tachycardic, tachypnic, shortness of breath, and dizziness on exertion. Typically, you'd want to test, have a CBC for hemoglobin and hematocrit. As far as my class is concerned, if hemoglobin is at a 7, then they want to start a blood transfusion. So that's just for my knowledge. So first we're going to start with blood loss anemia. So the effects and symptoms usually depend on the type, as well as the amount that's lost and the rate that it's lost. So there's acute and chronic. So acute blood loss is loss of significant volume. It then triggers compensatory mechanisms such as an increase in heart rate and constriction of peripheral blood vessels to maintain cardiac output. So fluid then shifts from the interstitial spaces to the vascular compartments. Blood is then diluted and the viscosity is reduced. If the hemorrhage continues, the compensatory mechanisms become less effective. So then we have an increased risk for hypovolemic shock. So some early signs and symptoms would be tachycardia, tachypnea, being pallor, cool, clammy, and then eventually then leads to hypotension and decreased level of consciousness. The circulating red blood cells are usually a normal size and shape. Early on, the hemoglobin and hematocrit are normal, but then will eventually drop, as well as the red blood cell count. If there's sufficient iron, then the number of circulating red blood cells and hemoglobin levels will return to normal within 3 to 4 weeks after the bleed. Then there's chronic anemia blood loss. So this could be something like an internal bleed, like a GI bleed, peptic ulcers, usually things that aren't known when they start, or a woman's heavy period, excessive blood loss. So this is leading to excessive iron loss, so it's chronic iron deficiency. So fluid shifts from the interstitial spaces to the vessels to prevent hypovolemia. Blood viscosity is then decreased and may cause a systolic heart murmur. So then iron stores are depleted as red blood cell production attempts to maintain the red blood cell supply, which then result in very small or microcytic and pale or hypochromic red blood cells. So usually they can do some kind of blood smear and look in a microscope, and they'll be able to see if they're small and pale for chronic blood loss. Acute blood loss is usually obvious, but they could still look and see that they'll be a normal size and shape compared to chronic. So that is blood loss anemia.